So, you can do all of this with your hands or forearms or feet or whatever. But within our scope of practice is using a device that mimics the action of the hands, they usually say.
To clarify, we're in the myofascial release workshop. I think it's part 4. And we're phasing into the ideas of some implement assisted concepts for myofascial release and or fluid movement, including lymphatic drain.
Very good.
Yeah.
All right. So, the lymphatic movement, that rocking back and forth and taking tissue to bind and back out again, is not as physically tasking as, and you can play with the ball on that. This doesn't take as much physical effort, but when you take something to bind and hold it at bind, that requires a lot of stabilization and an effort to hold it that way. So if we go back to the principles of what we're trying to accomplish here, judicious use of some types of implements, I think, are helpful, especially if they can do a better job. So when you have an implement, you've got sanitation and safety. Okay, that's a given. And you need to know what might be potential safety issues. Now in the entry-level textbook, Fundamentals of Therapeutic Massage, there's a whole chapter on this and complementary bodywork systems and that sort of thing. So lifting tissue and separating it is hard work. If you're just doing that for a little bit on one area or something, I don't know that I would break out a tool for that. But now, it has nothing to do with moving stagnant blood, and it has nothing to do with anything other than negative pressure or suction is going to do what? It's going to lift and separate. And it's going to do an excellent job on that with the superficial fascial layer. And allow for the lubrication to make that slide better. So, client, cup, suction.
Oh, I haven't seen.
That's a whole lot easier. Then I can move the ball, I can move the cup around, which is easier to grasp than the tissue. I can pump. Or I can actually slide the cup. If I had a little lubricant on it, that's all right, I don't need it. I can slide it along the tissue, which is going to create, that bind.
Can you use that, like the cupping, as your like assessment tool? Because you're talking.
Sure,
about,
you can.
Your the
Well,
motion and different.
You put it right there. You
And
put
by
it.
how much lift you get out of the tissue. So in this context, this ball is very pliable.
Mm-hmm.
The superficial fascia of the ball is so pliable that you see it create a big bubble. But you will, I got you. But you will see with tissue types, let's say there's a really bad scar, or there's cases where I've seen in the tissue up and down the spine, if somebody has been in a chronically, let's call it a hypertonic phase, where the muscles around the back and their whole torso have been really rigid.
So like
I don't know if you work with somebody, but it'll look like they have like a canyon down their whole spine, and it's just everything's super taut, and it feels like leather, like nothing moves. When you try to lift it with the cup, less of a bubble. be much less of a bubble and a greater sensation. The sensation of the client will be a big assessment tool for you as well. If it's intense, you know you're creating a disturbance of the nervous system receptors. If it's not as intense, then those nervous receptors aren't perceiving the lift as much of a intervention. So even the intensity, how much of a bubble, and with these they have more suction, the ones with the gun where you can really create the suction, the coloration. Where the tissue is less pliable, it'll get that echinacea kind of purpling, bruisey-ish, superficial bruisey, much more than on tissue so all of that, it's excellent. All of it can be assessment, depending on where your mind state is.
If I was gonna use this for assessment, the cup is now the still hand kind of thing. It's pulling that up, it's up there. Think of your X's and your, so da 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 dee 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 dee. Oh, doesn't move as good that way. Da dee 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 dee. You gotta sing or it doesn't work. All right.
Or at least put a very profound look on your face.
Now, once I find the binding over here, that's where I feel it. So I can just take this and go to ease. And the bind. I can add a twist. Now you can't leave that there very long.
It turns purple.
Yeah, it is sucking blood, all right, out of the capillaries in the area. Not particularly dangerous. You've seen the various cups. I saw somebody that's got cups that are the shape of hearts, so it looks like the person's got these heart things all over them. But there's strain on the capillary when you get that.
Now, in general, the silicone cups, we got to play with those a little bit, have less suction. So, like anything, if you were to use this as a primary tool and you had access to both, the silicone ones would potentially give you a little bit more. I would use that more as like an assessment. And for somewhere that's really bad, then I would probably need additional suction.
So
I'd be just a touch cautious if you have that start to puncture.
Yeah, I noticed that. I let go. So this is also putting a elongation. It's not elongation in this direction, but it is still elongation in this direction. So it's fitting in with our intervention concepts with it. And this is easier. It's not any better than if I did it myself, but it's easier on me.
Well, you don't risk like cutting anyone with your nails when you grab.
All right, so another one is taping. Now,
Before you go to taping, would you describe a little bit of the difference of using cupping on scar tissue versus for tetanus? Scar tissue is different when you use cupping.
well, you're going to have a series of bind. So we'll actually look at more specific cupping in the AP, and we'll look at this again for general massage in the entry level class. But it's excellent over scar tissue. Once you got a mature scar, I would be more cautious about using it over one that has not matured yet. But most of the scars we're going to encounter are old. And when you put the suction on it, lots of times they'll dimple underneath where the scar, you'll see right where the connective tissue layers have started to adhere to each other on down through. You want, typically with a connective tissue approach, when you're at bind, not at ease, but when you're at bind and through bind, it's going to have a titch of a rippy sensation to it. but you don't want it to actually rip. You don't want that skin to actually, breach or separate. That's why you gotta be careful with it on somebody who's elderly, because the skin is thinner. But with a scar, you know, that's old, in segments, over time, not all at once, you can start working with this. And I'm not gonna do that with, it's easy, that's $12, and I guess it's up to $18 on Amazon. The client can do this.
Well, that's what I do, I teach them
Yep,
with a silicone cup so they don't do harm.
you know, so this is a great thing for them to take home and do. But if I want them to experience it, or I'm gonna augment my massage with it, I don't hesitate, cause it makes my job easier. And some people aren't gonna like the sensation, it's fairly intense. And you know, you gotta watch some of the other things, but I want you to consider it as an option on how it meets the criteria. Now, there's more nuances to that. I mean, you tend to cup with something in a contracted state, in ease, but with tape, you tape it in, other way
tape
around.
it in ease.
You tape it in ease and you cup it in bind. So, okay, so you get to tape the ball, Luke.
That's gonna be interesting.
All right, and watch what happens to it when he puts the tape on it.
This would be slightly harder to illustrate just because what she was indicating with tape, you want to, oh no, you had it right.
I had it right.
I'm sorry, yeah. No, you lengthen the tissue first. You lengthen the tissue you're gonna tape. You make it longer first, so it doesn't matter. So if I'm taping the interior arm, I put it in extension. If I'm taping the posterior arm, I put it in flexion. Make sense? So you make the tissue long. We'll have a full-on taping day. I doubt it can even be seen right now. There we go. We will have a kinesiology taping 2-day workshop in the future. So that will be clarified further.
What we're looking at now, is there an advantage? Does this adjunct, does this implement here have an advantage? Will it extend the benefit? Does it mimic normal?
Now, part of this, just as a precursor to all that, simplest aspect that you need to get used to with the tape is how to put it on without making a mess. So it's called pre-tearing the anchors. You pre-tear the ends. The ends go on with no tension. That's just so they don't roll up as easily. The working part of the tape is the part in between the two ends. So however tension you're going to create, you create there, but no tension at either end. So when applying that, if I can just take the back off. Now it doesn't stick to me.
I will help with the ball.
All right, she's going to put the ball
In extension.
All right, so come around so we can see it. So she's gonna lengthen it. I put the tape on. Then it's gonna be a little nuance. Once I have the working part of the tape stretched, then I can basically let go. And I'm just peeling off those anchors. Putting it on, 0 tension. Peeling off that anchor, on 0 tension. You really can't do that wrong. And for lymphatic drain, you really can't do it wrong. You can split the tape and make it into a squid monster, or you can leave it in the squares like this. Doesn't matter, but it should usually, for fluid movement, since you want it to be pulling and being very elastic in all directions, should be 50% of tension or less.
Now, do you see what happened? You see those wrinkles? You see how, and that's lifting.
We'll call it keloiding, just like those keloid scars, but the principle is, and over the course of time, now, we have all this pull that's occurring directly at the tissue. One, it's recoiling toward itself and lifting and creating this dimpling effect. Now the client goes around and moves. There's this added level of tension, just like me taking it to bind, holding it there and having them do a movement. Now the tape is just sitting there on that spot, holding that section of tissue in bind. Now every time they move, they're going to create that additional level of friction. And so that's where, and so when she was demonstrating the idea of the little lymph vessels and tubes, that's creating the tension on that superficial fascia, so that it'll help reinforce pulling that fluid into the tubes. It's as simple as that. So for connective tissue or fluid movement, the tape on the area in general, there's lots of different ways you can do it. With a scar, you can do like a lattice work on it to try to get it tugged in multiple directions. If you're getting more and more precise, you assess bind and tape the scar or the hypomobile tissue into bind.
Or into ease.
Or into ease. So, or you take a section and you do some in bind and some in ease, and you just can be pretty creative with it. With the fluid movement piece of it in particular, you just simply can't do it wrong. You need any tape across the area that has the additional fluid in it is going to help.
Because it's lifting, holding it still, and then as you move, you get your pump with it.
Where a quick piece related to the tape, where you have to be cautious, is in the context of the adhesive and what it can do to the skin. Most tapes are very safe. KT tape, the main brand one, pretty safe, but the ones that are more for sports have a more aggressive adhesive. It'll stick better. So it's a difference between like Scotch tape and Gorilla tape, right? Rock tape. Rock tape is amazing. It has more rigidity to it, but the adhesive is much stronger. So the biggest caution you have with playing with this tape for yourselves and or with your clients is their skin integrity and where you place it. You don't place it on areas where the skin's particularly sensitive.
Do you have any tips for like removing it? Because sometimes you have patients with, or clients with more.
That's exactly, yep, that was in my mind. Thank you for the reminder.
Yeah.
So, with tape, best thing you can do for a client is slow, not like that. Slow under running warm water. Just soaking even in the tub, but the shower is the perfect place. Running warm water, hitting the tape directly. So as you peel, nice and slow, then that's as nice as it's gonna get. For if there's any hair, it's gonna be worse. So.
Do you have any tips for getting it to stick longer too?
That, either one, with clients where there's a hair issue, you might have to ask them to trim that in order otherwise it's not gonna stick as good. They have sticky sprays that you can buy additionally, but be aware, the same principle I talked about with having the better adhesive, it's gonna hurt more on the peeling off. It will last longer, but it'll hurt more.
And also like alcohol so that there's not like dirt or sweat on your skin.
Yes,
Yep.
yes, that's a very good one right
And
there.
it's more the oil.
Cleaning the skin off, getting it dry as possible. So alcohol is definitely the better, small amounts. Typically you're fine in even just for our purposes, making sure the lotion is mostly cleansed off. So that's the biggest inhibitor, is if there's lotion on the skin, certainly isn't gonna stick. And so when you're integrating it in massage, that's the biggest challenge you end up having. So, yeah, good question.
Just
So-
keep a bucket in your room.
What?
Just keep a bottle of bucket in your room.
A bucket.
Sanitizer, although it's not ideal, sanitizer is not ideal, and if you have some of the ones that have the aloe component, that'll have a little bit of a residual goo to it. But the more alcohol-based sanitizers have worked just fine for me in the past. Optimally, I just wipe the area down with a warm cloth and get it good and dry. That way I'm also not introducing alcohol on their skin. If ever I can help it, that's what I prefer to do. But in athletics, there's a tendency for that, where You're wiping the area down. It's sanitary too. Hey, you made sure the area is clean.
Well, Joanne uses the alcohol on herself internally.
It helps sometimes, I tell you.
It helps her connect. Now, just as a top off on this segment here, we looked at the massage method structure as assessment. And then we looked at the intervention and why. And then we looked at the modification of the method in order to mimic normal function. There's a little bit more to it, a little bit more nuance, but not much. Then we looked at a palpation idea to get the idea of layers and separation and what happens to the viscosity when you move it and all of that. And then we looked at how we can make our life easier with some of this that then can translate to self-help.
And like anything, being as aware as possible with that concept that she mentioned of mimic normal. Getting an awareness of what tissue type you're interacting with and what you can do to facilitate what would be its most optimal way of functioning. So fluid movement stuff, for example, I would want to make sure that the tape does make contact near to the hip. I have to be careful of that, but if I'm going to move fluid back to the core of the body, I'm going to want the tape to go at least all the way up to a main joint segment. If I'm thinking lymphatic drain, the tape should make contact from the knee down to the calf. It should make contact with the hip down to the knee. It should make contact from the shoulder down to the elbow, from the elbow down to the wrist. That way, and you literally can get just nice pretty pictures of the lymphatic fluid system. Follow the anatomy. You know, even if you're looking at it from a visual sense, get these clear, like good visual guides if you can. And if I have a nuance, at least specifically with the taping, is tape related to the anatomy you're trying to interface with. So superficial fascia, fluid, or deeper muscle compartments and connective tissue, think like that and tape accordingly. There.
Yeah, and you're either gonna go, I mean, there's a model over there, and look, it goes horizontal, it goes up and down, it goes on an X. You know, that's one of the first things we taught you at entry level. Go with the grain, across the grain. Make X's. Because you're gonna load the tissue in different directions. So, what we're gonna do is take a lunch break. I'm gonna get, because I didn't necessarily prepare everybody, I'm gonna give you 45 minutes. And then when we get back, we're gonna see the modifications for this when you do it on a human being. Ooh.